I want to thank everybody for coming, and I want to introduce our guests. I'm thrilled to see a panel of guests here because there's so much to cover, and I think it takes a village to really figure all this out. It's just a lot of information. But we would not be where we are without a wonderful community of partners. And we have partnered with Unicity as a part of our community, and they've done so much for us over the pandemic, and even before the pandemic started, keeping us safe and keeping us informed and doing all kinds of great wellness programs. So it's always I always welcome Unicity as our first wellness lecture of the month. That's their time slot. And they always give us great information. So today we reached out, and Laura Jaros and Lisa Pritchard, who we're working with at Unicity, put us in contact with Care One. So this network just spreads, and wonderful people come to the surface, and we're so happy to have you. So I want to just introduce Lisa Pritchard, who's working with Unicity now, and if you'd like to say a little bit about Unicity before we introduce our first guest.
Sure. So good morning, everyone, and Happy New Year. Hope everybody had a pleasant holiday. I'm sure it was a little bit different, but pleasant nonetheless. So I'm Lisa Pritchard with Unicity Home Care. We provide home care for clients who find themselves either at home or in assisted living facilities or in a variety of healthcare facilities, and they might need assistance of a variety of ADLs, just companionship. We are here to provide that service to supplement, care for your loved ones. We also have geriatric care management, and that's a whole other service that we provide, for people who might be in transition, families are needing some assistance or support with making the next step for their loved one. But today, I'm pleased to introduce Shannon, that she has graciously, accepted our invitation to come and be a part of the discussion today, and answer all of the questions related to COVID, your concerns. No question is a question that's silly. Whatever your concerns are about COVID and the vaccine and what should you look forward to and what's the next step, I'm sure Shannon will be able to provide you with some guidance. And thank you, Michelle, as always, for inviting us and including us in the Wellness Talks the first Wednesday of the month. So without further ado, I would like, Shannon to begin. And if anyone has a question, that's why we're here. That's why we've asked Shannon to come to hopefully alleviate some of your concerns, maybe fears, or just the unknown of what to expect moving forward with this pandemic. Thank you, Michelle.
Thanks, Lisa.
Thank you, everyone. Thank you for having me. You guys heard, my name is Shannon. I am the Director of Wellness at Care One Livingston Assisted Living. And I've been a nurse for over 21 years. And yes, I've got to experience COVID very intimately. And we are in a very, very wonderful place right now, even though it doesn't feel like that in the world, because we've been introduced to the vaccine. So yes, for the last 9 months, or it feels like 20 years, we've been washing our hands and wearing our face coverings when we've been going out to the stores and limiting ourselves from going out to the stores to keep ourselves safe. So we now have the opportunity to have or get the vaccine. There are 2 vaccines that are available to us, the Moderna vaccine and the Pfizer vaccine. I want to let you know that both vaccines are a 2-step vaccine. So meaning you get one, and then in a few weeks, again, you have to get a second one. The Pfizer vaccine is given to you again in 21 days, and the Moderna is 28 days. So there's a difference of 1 week between the vaccines. Both are 95% effective. Moderna is 94.3 and Pfizer is 95% effective. And the reactions that you could typically have from a vaccine are like any other vaccine that you normally would get. Soreness around the arm, around the injection site, which I did get the vaccine last week and I did have that for about a day. And then it went away and I had nothing else. You can have a little bit of achiness which is a very normal reaction. It's your body's way of building immunities. That's all that reaction is. The virus is not a live virus. There's a lot of misconceptions and rumors that it's a live virus. I'm going to get COVID if I get the vaccine. You will not get COVID if you get the vaccine. It is not a live vaccine. It is a vaccine that helps you build antibodies, and it helps your immune system learn the virus so that if you are exposed to the virus, your body will fight it. I felt, like I said, just a little sore after my shot. I took 2 Tylenol, and I really felt okay for the rest of my time. And I get my next vaccine in 2 weeks, and I'm very excited to do so. The reason why you need to get 2 vaccines is because it takes that much time for your body to build up antibodies. So the first vaccine, after you get it, your body is about 50% immune. That second vaccine helps your body build up that second half of the immunity to help fight against the virus if you are exposed. It is so important for all of us to go out and get this vaccine. We've been living in a world like no other, like we've never seen, or most of us have never seen. In order for us to have to stop wearing those masks and stop having that reduced amount of time with family and our friends, we need 80% of New Jersey to be able to vaccinate in order for us to go back to a somewhat normal world. I'm excited to have my residents getting their vaccine in another week. So here at Care One Livingston, we will be vaccinating everybody. Even our residents who come for only a respite stay, they will be getting vaccinated as well. So if they're here with us, even for 30 days, they're going to get vaccinated. My employees are getting vaccinated. It isn't a mandatory vaccine, but like the rest of the world and all the viruses and that we've ever encountered in our lifetime, it's the same system. So when polio was around, when smallpox was around, all those vaccines that we've had as children or even as teenagers or adults, depending on when you were vaccinated, it's the same type of system. And this is why we need to be vaccinated for COVID. If you had COVID before, you should still get vaccinated. No one knows how long the antibodies, once you've had the virus, stay in your system. So it is important that even if you've had COVID, you get vaccinated. You do want to talk to your healthcare provider if you recently have had COVID and you want to get the vaccine, because we want to make sure that you do it safely. But having the vaccine, even if you've had COVID, is important. It's just like having the flu. We get the flu shot every year. Sometimes you never had the flu shot before. It's important to get the vaccine. There are a lot of myths and rumors and different stories that I've heard along the way. It affects my DNA. It does not affect your DNA. It's not a live virus. It cannot give you COVID. You're not going to get sick with COVID if you get it. You won't test positive for COVID if you get the vaccine. I feel very strongly about this. I do have 3 kids at home. I have my mom who lives with me and my husband, and once available to my mom, she will definitely get it, as will my husband. And, you know, when my kids are of age to be able to receive the vaccine. So right now, children under the age of 16 with Pfizer and Moderna, you have to be 18 or older to get the vaccine. So my kids are underage right now. But once that happens, I will feel confident and I will have my children also get the vaccine. If you get the vaccine, it doesn't mean that you don't need to wear a mask. You don't need to worry about anything. It's still important to protect yourself and to wear that mask properly over your nose and under your chin. And to continue hand washing and to not see people if they're not feeling well, and to make sure you social distance and do your 6 feet. It's important. It's important to do all of those things until we're told otherwise, because that's our best defense mechanism. No vaccine is 100% foolproof. You know, it's not 100%. They're 95%, just like every other vaccine that we have is nothing's 100%. but it is the best way to fight this virus besides what we're doing right now. I would like to ask if anybody has any questions, because I feel like our conversation would be better off if there was questions or concerns or thoughts for me to be able to answer.
Yeah, Shannon, we have a lot of questions coming in, so I'm just going to start with, is it necessary to wait a certain amount of time between recovering from COVID and getting the vaccine? That's our first question from Kathy.
Sure. So Kathy, yes. So that's why I would suggest speaking with your physician. So when you get COVID, most people develop an antibody to the virus. It's a short-acting antibody, but we like you to not have those antibodies because we don't want more antibodies into your system. We want the vaccine to work on its own. So usually we say 90 days after you had the virus. So the day that you were diagnosed with COVID, usually we say 90 days. But again, your healthcare provider would be able to tell you your best answer, but we normally say 90 days once you were diagnosed with COVID. From that, you can receive the vaccine because your natural antibodies that you have usually last about 3 months. And then after that, your antibodies go away.
The next question is, where is the schedule for who gets vaccinated when? I know, we're in 1A right now, right? We're in phase 1A still?
That's correct. So nursing homes, assisted livings, hospitals, healthcare providers, those are the people who are getting it now, but you could definitely check the state website. You may even be able to check the county website to see when that will be opening, the areas nearest you and what you can have. Doctors' offices do not have that. I can tell you that right now. They don't have.
Katie and I, after this program, will be sending out a very comprehensive email with all kinds of information, including, Joe, the who gets vaccinated when. When I just looked at the state site, it talked about being in 1A and defining who 1A, who the 1A people are, and then the 1B people. I think that there's sort of haven't yet determined the criteria for the next phases. And I think it's sort of developing as we go through this. It's sort of a work in progress, but for sure, there's a brochure that we'll attach with that information so that you could see. I think right now it's, like Shannon said, the healthcare providers and people that work, first responders, people, janitors. I'm sure, like you said your whole staff, right, is getting.
So it's not mandatory, but we highly encourage it. And, being in an assisted living or any healthcare facility, you experienced COVID very intimately, whether you had it yourself or you treated residents or staff or family members or other patients who had it. So most of my staff are receiving the vaccine because, we saw it way too close and we don't want a repeat of what was there.
Sure. The next question, Johnson & Johnson's vaccine is only one dose. Will it be as effective as the others? And when might that be available? Do you know?
I do not know about that because it's not been approved. So the only two approved vaccines for the United States at this point are Pfizer and Moderna. There's a lot of rules and regs that have to be brought out. So once they have that, they'll go through the FDA to get approved. But right now, Moderna and Pfizer are the only two vaccines that are available to us currently.
And the next question is, can we select which vaccine we get?
So most sites, wherever you are, they're going to have one vaccine. It's not going to be two different ones. I can tell you I got Pfizer. But I didn't know what I was getting until I walked up and they told me. Mm-hmm. So you can call the site and ask, but honestly, I would have been fine with either one. I was happy just to get the vaccine. All vaccinations in general have multiple manufacturers. And it's not normally a question we would ever ask. But because this is brand new, mm-hmm. we are a lot more in the know and are aware and being told a lot more information.
The next is really a rhetorical question. Why do some healthcare nursing home workers refuse to get vaccinated? What's wrong with these people?
I totally agree. I am a proponent. It is safe. We would not be introduced to something if we were not safe. But again, it is right now choice, just like everything else. Will it be choice forever? I don't know. But right now, they are just not opting. I will tell you, most of my staff is opting to get it.
Yeah, yeah. From Kathy, is wearing 2 masks more effective? Are paper or cloth masks preferable? Any thoughts on that?
Sure. So surgical masks are always your best covering. A surgical blue or yellow or whatever color they come in, surgical grade masks are always best. But a cloth covering is effective in a store. I mean, you want to keep your social distance. You want to hand wash. You want to make sure that your nose and your mouth are covered. But a surgical mask will, if somebody does sneeze or cough, create a little bit of an extra barrier. Would I wear 2 masks? No, you can. But 1 mask, you're protecting yourself from, you're protecting others when you wear your mask. So that's why I always say, if you don't want to do it for yourself, you want to do it for everybody else. Because if you sneeze or you cough, your particles are going right into your mask. And when you don't, they go everywhere. So you're protecting everybody else when you wear your mask, which is why it's so important for everyone to be doing that, because they're protecting you just as much as you're protecting them when they go out to the store.
Okay. The next question, I heard that after the first jab of Pfizer, you're 85% covered, and after the second, you're 95. If it all works, is this real? I think you said 50% after the first jab earlier.
It's between 50 and 75%. So as the 3 weeks go on between the current time and the 21 days, your body builds up the antibodies, but it's really not until the second dose that you have that full 95% immunity, which is why it's so important to get both. And then also just an added to wherever you go, if you get Pfizer, your second dose should be Pfizer. And if you get Moderna, your second dose should be Moderna. You should not crisscross them.
I've been having dental work. So far, I've not had to take an antibiotic, but what if the dentist puts me on one? Can I still get the vaccine?
Yes, you absolutely can get the vaccine. It's about being healthy, just like any other vaccine. You don't want to be running a fever when you have your vaccine, and you want to feel good. You want to feel, allergies don't count. That's not has anything to do with it. You just want to feel healthy, like you would for your annual flu shot.
The next question, I signed up online to be vaccinated at West Orange. I had to choose a date, but doubt I'll receive the vaccination by then. Do I need to register again?
Why do you not?
You know, that might be, I don't know if Katie might be able to answer that. Because Katie, do you have any insight on that?
I'm sorry.
She signed up online to be vaccinated at West Orange. I had to choose a date, but I doubt I'll receive the vaccination by then. Is that, I'm assuming, Jean, that's because you're not in the correct group yet. So you're worried that your time, and somebody else on our last meeting just, I think, mentioned that she was recommending that you just go if you've signed up for a time.
I would definitely go if you have a time, and let them determine whether you're allowed to get the vaccine or not. You know, as you've been hearing in the news, the rollout has been extremely slow. So, you know, there's a lot that goes into it. There's a lot of, you have to fill out your form. You do have to, you know, they have to make sure that everything's okay. And they do monitor you afterwards for 15 minutes to ensure that, you know, nobody's having any type of a reaction immediately after the vaccine. So it is a process. So I would definitely go. I would not tell you not to go. And if they tell you otherwise, then you would reschedule. But if they gave you a time slot, they might even call you prior to ask you some pre-screening questions. And then that's how they may determine whether you're allowed to come down or not. But if not, I would go.
I didn't get a time. I just got a date. It was the last date I could choose.
Yep.
And I'm in the second group. There's no way that I'm going to get the vaccination by this Saturday. I know that.
No. You mean you're not going to get? Why wouldn't you get the vaccination if you have a Saturday time this Saturday?
I don't have a time. I just had to choose a date, but they did not give me a time.
Right.
and I'm in the second group. They're not going to be doing the second group.
No, I understand what you're saying. I have, if we could talk later about this, Jean, but we just spoke to a few people that said they were in the same position. Are you talking about the West Orange site, the Kmart site?
Yes.
And they didn't get a time, they didn't get contacted, but they were able to get through the whole, that whole thing. They showed up without a time and they were taken because they were in the system. I think what's happening, and this is what this is my determination based on what I've heard, is that there's a lot of bottleneck in the system setup. So the system was sort of set up, and then there was sort of a testing phase where, and then now they're sort of honing in on how they need to streamline it. But we just spoke to people that actually just went on the day and they took them. You might as well take a chance and go. It's not like there are people lined up outside the place.
I agree.
They were just they're taking timed appointments, but if you show up and you're in the system, which you are for that day, the chances are they'll take you. Don't quote me, but this is what other people on a previous call just said. So we could talk more about that later, Jean, but it's a chance you can take. You might as well. If you got that far in that site. The website for New Jersey, this is another question for COVID, allows you to pre-register for the vaccine. Is there any advantage to pre-registering? I think so, Marie Claire, based on what we just heard. And
I would pre-register if you could.
Because again, you're sort of filling the system and you're giving them the information. Now they just have to start disseminating it so you've sort of preloaded it. And then when your time comes up, when you're not going to get as far as I think Jean did, you're going to pre-register, but you're not going to get a date. I just tried to do it myself. Couldn't get a date because there were no more dates in the system. They haven't gotten that far. Now they've kind of caught up a little bit. But definitely pre-register. It can't hurt. And then they have the information to get you in when they're ready for you. So, you're taking that first step, I think is a good thing. Can you pass on the virus even after you've been vaccinated? Can you pass on the virus even after you've been vaccinated?
So the vaccine is not a live virus, so you can't get the virus from the vaccine. Now, if you get the vaccine and you start to get symptoms such as the COVID symptoms, and you go to your doctor, it would be because you've been exposed to somebody prior to going to get the vaccine. It doesn't mean the vaccine has caused you. So you can't spread COVID to another person by just getting the vaccine. It would be because you actively have the virus because you were exposed prior to getting the vaccine.
No, what I meant was, if you've gotten the vaccine and you're exposed to somebody after the vaccine and whatever, but you don't necessarily have any symptoms, can you carry it to somebody else? Do we know that?
So the virus is airborne. It is everywhere. So it exists on surfaces, which is why we are to stay 6 feet apart, which is why we are to hand wash, which is why we are to, when I go into the grocery store, I wipe down with a wipe, my shopping cart. So can you pass the vaccine? They're saying they're not, it's airborne. So yes, anybody can pass that on. It's your body is fighting the own virus for yourself. Just like the flu vaccine. You get the vaccine, you were exposed to somebody with it, you don't get it, but somebody else does because you have the vaccine and your body was able to fight that off. But the exposure is from somebody else.
Okay.
So I would continue, once you have the vaccine, which I hope all of you go out and do, you still need to practice exactly what we've been doing for the last 9 months. Social distancing, 6 feet apart, washing your hands, wearing your mask, no crazy gatherings of a whole bunch of people. We need to continue to do what we're doing until we get to that point where most of the state has been vaccinated to prevent exactly what you just asked.
Right. And so, Marilyn, to what Shannon just said, if you get vaccinated, you're safe, right? But somebody shakes your hand that has COVID, and then you shake somebody else's hand that wasn't vaccinated, you can probably, possibly pass the virus because it's live, right? It's not side of you, but it's on your hand, and then you're shaking hands. So that's why, practicing, hand washing and still doing all those things to protect other people.
No, I know we still have to do everything we've been doing, but
Yeah.
okay, thank you.
Confirming that there is no timeline at this point for the move to phase 1B.
Okay.
Is that, Shannon, would you say that you would say?
I would say yes, that's true. It's so hard to say. The rollout has been slow. The news has said it. Walgreens and CVS are the two companies that have pretty much been giving it out, along with hospitals. But you need the manpower to be able to pass out the vaccine, and it needs to be done safely and effectively. So it may take a little longer than we all wanted. I think we all thought we were just going to get like the flu vaccine. We were all just going to get mass doses and be able to give it to everybody. I would love to have like a drive-through and vaccinate everybody who would be willing to come through. But it's new, and we want to make sure everybody stays safe in the process. So it's going to take a little bit longer than I think we anticipated.
Yeah. And then somebody asked, will we need to get it every year like the flu shot?
They don't know yet. They're waiting to see on antibodies. So, we have the vaccine. We'll be able to see once we get that second one, in 6 months, do we have antibodies? In a year, do we have antibodies? Or will it be like the flu vaccine? It is a very good question, but it's one that we don't know the answer to yet.
And then on the coattails of that, what about the new South African mutation? Might it be better to wait until they are sure the vaccine works for it, or is changed to handle it?
So like the flu vaccine, that might be why we might need to get one every year, but I would not wait to get the vaccine. They've done a lot of work with the vaccines, and we don't know the mutation of it to decide whether this vaccine will work or not. I would not wait. I would not wait to get it.
The next question, the New Jersey COVID website, when you pre-register, asks for medical insurance. I thought the vaccine was free for everyone.
It is free for everybody, but they still do request it. I had to hand in my insurance as well. But it is free. So if you have no insurance, you just leave it alone. But if you do, they do ask you to input it.
Free because they're obviously billing Medicare. They would bill Medicare for it if you're a senior.
Yeah, well, I'm sure they're billing my insurance as well. What that will pay, I don't know, but it is free if you do not have any. So they want everybody together, whether you have it or not. But if you do have insurance, they will, take it to bill. What that is specifically, they haven't stated.
Okay. Should you go into the system for the Kmart? So just to explain, the Kmart is the Essex, one of the Essex County sites. There are different. I think there are 2 sites for Essex County. We'll give you all that information, but if you go, they're going to tell you based on where you live, what site. I think the other one is the Caldwell, the technical school. I think that's the other site, is that technical school, I think. But the Kmart, you don't request which site, they tell you where to go. From what there are 2, we're going to give you all like I said, we're going to send out an email with all the specifics, but there are 2 sites you could pre-register on right now. One is the state site and one is the county site. I just tried doing it on the county site and I didn't get very far because there were no appointments. I've heard that today people, Katie also mentioned that if you should, any of these sites that you register for, if you do them late at night, sometimes if you do it like 1 minute after midnight, they reload. So that's a little tip when you're trying, even Instacart, apparently if you do it later, like, midnight, or just when the site sort of reloads for the next appointments, the next lot of appointments, that sometimes that's like a little trick. The other thing I heard was that the state and maybe also the county site don't like Safari as a browser. So if you have Chrome or Firefox, but apparently they're not a Safari. So if you have another browser, you can open it and it may not work. So just something to keep in mind. If it's not working, you might want to try a different browser. Let's see. Does the New Jersey website pass the info into the Essex site? I don't know the answer to that. Do you, Shannon?
No, I don't.
I don't know. I don't know.
I don't know how the trickle down works.
Yeah, and again, I'm thinking that if you go to the state level, they may trickle it down to the county level. But you know, like I said today, I've heard that the state was accepting more widely more information than the county was at this point. The county seemed to be overloaded. So you might just want to go to the state, but I wouldn't do both. I would just do one. And if I did one, I would probably just do it on the state. But you could try the county, but again, I just tried it a few minutes ago before the call and I couldn't get very far. For those of you who getting to the point where you can select a date, what group are you in? Okay, how do you answer the questions to get a point? I believe you guys are in group 1B, is that correct? Seniors, people over 65 or group B, is that the group B?
Mm-hmm.
Frontline essential workers, high risk groups.
Right.
I would say 1C, high risk groups, if you have any pre-existing conditions, a lot of seniors do, then you would be a 1B. A 1C is essential, 65 and over is the 1C. So again, like Marie Claire asked, should you pre-register? I think it's best to pre-register, and then you're in the system. So I received a second dose of the pneumonia vaccine a week ago. I'm scheduled for the first dose of COVID on Saturday. Is this okay? Shannon, any thoughts?
I don't see, nobody has, so I would double check with your doctor. That would be my first answer, but there has been no indications that you are not allowed to receive vaccines a week apart of something different. So I would double check, but I don't see a reason why not.
Yep. Pre-registering right now, and you can check off Medicare and you don't have to enter any other identifying info. You can leave the insurance blank. You could say, do you have insurance? Yes. And then they ask you for the number and you don't have to, you can leave it blank. I noticed that too. Essex County has assigned each town to a specific site. If the site is not convenient, can you go to another site for the vaccine? I don't know the answer to that, Patty, but we'll get back to you when we have more information on that.
Okay, thank you.
Essex has 4 sites.
I believe the Livingston Mall, the Sears, is going to be a site here as well.
It is. People were talking about that today. The Sears and Livingston Mall. I think there's a site in Newark. There's the Kmart, and then the one in Caldwell. Depending, and they have it listed by towns, and that will all be in this comprehensive email that we send out.
My concern was I'm in Belleville, and they assigned Belleville to Livingston, which is like the furthest site away.
Yeah, really.
And with cataracts, I'm not driving that far, so I just wondered if I could get maybe to the West Orange site, which would be much more convenient.
You might, there's a number we're going to give you a number to call. You can call a number, and that'll be the, the clearinghouse for information. We're going to give you that number to call. It's an Essex County number.
Okay.
People answering the phone there. So
I'm sorry.
I registered on a state site this morning with Safari on my phone. It worked fine. Okay. So maybe it's the county site that wasn't taking Safari, but that's good. I'm glad to hear that. I just finished registering on the state site. At the end, it was told you were eligible for a later phase of, you are. So now they've actually streamlined it. So now they're saying you are eligible for a later phase. We'll send you an email when you're ready to schedule you for an appointment. So that's what a lot of you will be doing that. You'll be scheduled if they ask you, the pre-screening questions lead you to a pre-existing condition, you might get in that 1B. They're not asking for proof, and I'm not suggesting that people lie at all, but I think it's an honor system. So, I mean, I don't have a pre-existing condition, and I'm not going to say that I do, but be honest. And if you do, you should say that, and they're not going to ask you to bring your medical records with you. They're just going to take your word for it. So I think if we're all honest about it, I think the right people will get the vaccine at the right time. Can you give us the website? Yes, we're going to give you all the websites to register. We're going to send that out in an e-blast, so you'll have all that. I'm not able to take the vaccine in my arm. Shannon, can I get it in the glutes like I get my flu shot?
Yes.
Okay. All right. Is that the end of my questions? Or it said it looked like I had a lot more questions, but now I think I'm at the end. Does anybody else have any other questions, comments, concerns? I know that there was a lot of, we talked about this morning on this meeting, this word of mouth. Shannon, did you work with Walgreens or Rite Aid or CVS? Did they administer your?
CVS administered my vaccine.
So major pharmacies are partnering, and there was some talk yesterday, the day before, about ShopRite being a vaccination site possibly. Which somebody was very concerned about. I don't want to go to ShopRite for my groceries. Why would I want to go there for a vaccine? I also heard yesterday a friend of mine who actually works for your LTAC at Care One, your LTAC Trinitas. He said that she signed up on the state website, and there was a drive-through. They have a drive-through. One of their sites, you don't get out of the car. They say, wear something comfortable and get ready to, drive up and get punctured.
Yeah. I mean, exposure, the less exposure you have to everybody, that's part of the problem of having the vaccine clinics, is that we want to make sure that everybody stays safe, even at the clinic. You want to make sure that you keep the social distancing, that you don't arrive too early for your appointment. If you're given a specific time, arrive right before your time, so you're not sitting there exposing yourself to everybody else. Plus, you have to sit 15 minutes to be observed to ensure that you have no reaction. So you want to make sure that you continue to, observe all of the protocols that we have.
Yeah. Just so the folks on the call that live in Montclair, this is something that Katie and I, in particular, are really working on getting this information out to our seniors. There's a lot of information out there. It's evolving, and there's a lot of information we don't have yet, unfortunately. But we're trying to anticipate problems. One of the problems being, what if you don't have a computer? That was my question this morning. We have a lot of seniors out there that aren't on this call that don't have computers. And the answer is, if somebody's a homebound senior, they're not they don't have a huge risk, right? Because they're homebound. They have other risks with healthcare risks. But if you're a homebound senior, presumably, if you have a home agency like Unicity, or their Unicity is making sure that their home health aides are vaccinated, and so that when they're coming into your home, they are vaccinated. And if they're the only people that you see, then you're pretty safe. And then at that point, I don't know if home health agencies will be administering, the vaccines to homebound seniors. I don't know. Do you have any idea?
No, it hasn't been stated yet whether that will happen right now. There are protocols in place to ensure that the vaccine is given properly. So all the people who are giving the vaccine, even if it is a ShopRite, they are trained to give it. There is a small course that they do have to take to make sure that it's mixed correctly, that it stays at the temperature that it's supposed to stay at, because we want it to be effective. So it's not just going to be, your run-of-the-mill Joe Schmo that gives the vaccine. It will be somebody who's been trained to give the vaccine. Like I said, I'm not even going to be giving it to my own residents. CVS is coming in to give it to all my staff and to my residents. So just so you know, it is somebody who has been trained to give the vaccine.
Somebody else wrote, I've heard that after the vaccine, you can agree voluntarily to be part of a year-long study of how it's going. Is that true? Do you know anything about that?
That I don't know about.
And are 75 and older differentiated from the 65 and over? I think the 65 and over are people with, the 65 and over is more of a general population. And anyone from 16 to 64 with any kind of medical condition, pre-existing condition. So that's the 1C group. And again, all of these, these subgroups will all be categorized on the very extensive paperwork and brochures that we're going to send you, so that you'll understand that better. Does anybody have any other questions? There's a phone call, there's a hotline, there's a number where there are people actually picking up the phone, and we're going to give people that number to get more information. And again, this is the first time we're doing this. And I imagine this is the first of many, Zoom calls like this, where we're just going to be doing this. We're going to be, getting the information out. Katie's, I think, on another call right now, talking about transportation. How do we deal with can't get, how they can't, if they can't get to the Essex County site, for instance.
Yeah, I just got off it, Michelle. We've gotten confirmation, and we'll send out more information when we get closer to making appointments for older adults. But we've secured free transportation for Montclair residents using our existing relationship with Easy Ride, the people who operate the senior bus, but they would be Uber or Lyft rides. So stay tuned for that information. I know that they're saying that, they want people to use their private vehicles, but we've already gotten the site approved as a destination. It's just a matter of when we do the outreach about it, because we don't want people to think, oh, I can go get an appointment now. But we will have transportation for older Montclair residents. I'm also working on advocating for transportation for, the other people that I don't usually care about, the people who are not seniors. So we're working on that, because I know, every younger person who's vaccinated is also a person who's protecting some of our older residents too. So stay tuned. We're working on it.
Great. Thank you, Katie. Do you have anything else you need to share with us, Katie? Anything else?
No, you say that like I should.
I did.
I'm back,
I
I'm
do
back
have
to
a
full
question.
time. You'll see my face more often. So yay.
I'm sorry, I put my question in late.
Okay.
What are concerns? Like, I have a latex allergy. Is there any concern about that? Other than the person given the test not to wear latex gloves?
Right. So most gloves, we do not use latex any longer, but there's been no report of any latex in the vaccine.
Okay, thank you.
And
Can I ask a question?
yeah, go ahead. Go ahead.
If you were assigned for your first dose in one place, will you be going in the same place for your second dose?
I would say yes. So when you get vaccinated, they give you a card with the brand that you're getting it, Pfizer or Moderna, the lot number, when you receive the vaccine, and you'll bring that card again for your second one. So I would assume that because everything's divided by county and town, you would be going to the same place that you're getting the first vaccine, and then you would bring that card. And remember, like I said, it should be the same exact brand that you manufacture that you received the first time.
Okay, thank you.
Of course.
And Katie posted the hotline number. The Essex County has a call center for COVID-19 vaccination and testing questions. The number's in the chat. It's open from 8 to 8. And 8 to 5 on Saturdays. And somebody just called and said they answered immediately. So that's good. And for those of you that have family and friends that are seniors without, or even just people without computers, without access, those people that can't make an appointment online because they don't have online, those questions can be directed to the hotline, and then somebody will be available to make the appointment for you and be able to do it over the phone. So I would suggest directing those calls to that phone number. And Bloomfield also, according to Diane, said that they would be having transportation. So that's really good. Yes.
I have a question.
Yeah.
My sister is a senior and 70 plus, and she's had Guillain-Barré. Now with that, she can't even have the flu vaccination. How about the COVID? Can she have that?
I don't know the answer to that question. They've never related anything related to the Guillain-Barré like they do with the flu vaccine. But again, I would speak with her physician, and she should directly speak with him to talk to her, to speak about that, to make sure it's safe before she gets it. Yeah. And if it is safe, then she definitely should get it.
Okay. Thank you.
Of course.
Also, if you're a part of a group like Vanguard Medical Group, and I know they're in Verona, if you're part of Vanguard Medical Group, they sent out an email discussing the vaccination rollout. So if you're a part of a group like Summit Medical or Vanguard, you might want to contact your physician and talk to them about how, what their suggestions are, and obviously talk to your doctor if you have a medical condition. There was some talk today on our previous call about, there's a question apparently on the screening, I don't know if you know this, Shannon, about being on blood thinners or having a clotting issue. Do you know about that?
It is a question they asked because when I filled out my form, I did ask it. But and to be honest, I take aspirin every day, so I did check yes on mine. But they did not ask me anything further.
Yeah. So we kind of dug into that a little bit because a lot of seniors are on.
Yep. Mm-hmm.
And but it was really more about the site, the injection site bleeding. Like you could get a little prick, and if you have a blood clotting disorder specifically, that could cause, right? Is that just from the injection site?
Yes.
That could cause bleeding. So I think it's not to worry, but again, you want to be honest and you want to talk to your doctor if you have specific medical questions.
There are no egg, you don't have to worry, like the flu vaccine, they ask you about egg allergy, latex, preservatives. Those are not, they do not contain those in the vaccine. So those are not concerned. Latex, preservative, egg. So even though it may be something eventually that we may need to do yearly, it is different than the flu vaccine.
Right. Okay. Does anybody have any other questions before we wrap this up? Again, I want to thank Lisa Pritchard and Laura Jaros and Unicity for putting us in contact with Shannon today from Care One. We really appreciate it. We hope to do maybe some more programs with you in the future. That would be great.
Absolutely. Thank you for having me. I was happy to talk about COVID, and I hope you all stay safe and wash your hands and wear your mask, and please go get the vaccine when you're able to.
Thank you so much, Shannon. Really appreciate it.
Thank you so much.
Thanks, everybody.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Bye.
Bye.
So everybody
Thank
that's
you.
participated, we're going to be sending out a pretty comprehensive, and also I think to people that weren't able to make it, we're going to send out a sort of a fact sheet with all the links to everything. So just look for that. And this program was recorded and will be edited and uploaded on our YouTube channel. So you can watch it again, or you can recommend it to those that couldn't be here today. So again, thanks everybody.
Thank you.
Thank you.
Just a quick reminder that the program, the Northeast Coalition, Jose German Gorman's presentation that was supposed to be at 2:00 today has been rescheduled until Friday at 1:30. So if you signed up for that, or if you'd like to sign up, find out about all these great programs that are happening in Essex County and in Montclair, gardening, having to do with ecology and, saving the environment. Please come on Friday, not today. So it's been rescheduled from today at 2 until Friday at 1:30. Okay?
Thank you.
Thank you.